Hi, my name is Alicia, and am a level 2 Mohawk McMaster nursing student, and I'm here to give Mr. Mancini a sub-Q injection and an IM injection. So, while looking at the MAR, it says that heparin 5,000 units subcutaneous every 12 hours, and the Halidol is 1 milligram IM every 4 hours PRN. So this was done on January 15th, 2018, and the 8 medication rights that we have to confirm are the route, which is IM or subcutaneous, the time, which is the current time, the medication that we're giving, the patient, which is Mr. Mancini, the dose, which is 1 milliliter of the heparin, and the 0.5 milliliters of the Halidol, and the site, which is the abdomen. You have to do proper documentation and note the frequency that we would be giving it. So, looking at Mr. Mancini's MAR, we can see that he's allergic to codeine, which is good to understand before giving an injection. And his body size and muscle build is average, so knowing that we can give a injection using a certain needle type and syringe that's good for the patient of that size. Okay, so we were going to be giving a sub-Q injection and an IM injection. So for this injection to Mr. Mancini, for the sub-Q, the needle gauge is going to be a 25 gauge needle, and for the IM injection, it is going to be a 21 gauge needle. And for the syringe for a subcutaneous injection, we are going to be giving a 3 milliliter syringe because we are giving him 1 milliliter, so it's the appropriate syringe to give. And that is the same for a IM injection, as we're giving 0.5 milliliters, and the appropriate syringe is a 3 milliliter syringe. So I'm going to wash my hands here with some hand sanitizer, and we're going to assemble the needle syringe for a subcutaneous injection. So this is the syringe we're going to be using for a subcutaneous injection, which is a 3 milliliter syringe. So I'm going to open it up and take it out, and then open up my needle. And this is a blunt tip needle, and we are using this one to puncture a site in the vial, and so it won't be damaged when giving the injection to the patient. So I'm going to use a sanitizing strip to sanitize the lid of the vial cap before injecting into it. So once that's done, I can take the syringe and the needle, and then I will just lower lock it into the needle like that and pull off the lid carefully without getting a needle injury. So now that the vial is clean and I have my blunt tip needle, I'm going to puncture a site into the vial. And under Mr. Mancini's medication orders, we are going to be giving him 1 milliliter of heparin subcutaneous. So now I'm going to be doing this so that I don't get any air holes in it, and draw up 1 milliliter of heparin for Mr. Mancini. So the 1 milliliter has been drawn into the needle, to the syringe, and I'm gonna recap it now. So carefully, without touching it, I'm gonna insert it into it and push so that it is recapped. And now that it's recapped, and since we're doing 2 injections into Mr. Mancini, it is good to use a medication label. And so on here, I would do the patient, Mr. Mancini, his room number, the drug, which is heparin, the amount, which is 1 milliliter, and the flow rate and the start time and the date, and then I would stick it to the syringe so that it would be properly labeled. Okay, so now that we've got the subcutaneous syringe ready for injection, we're gonna get the IM syringe ready for injection. So first I'm gonna perform hand hygiene, and we're gonna be using a 3 milliliter syringe, filling it up with 0.5 milliliters of the Haldol, which is going to be giving IM. And we're gonna be using a 21 gauge needle. So first I'm going to get a alcohol pad and wipe off my vial so that it's sterile. Okay, so now I'll be opening up my 3 milliliter syringe and my 21 gauge needle. So getting my syringe, I'm going to be luer locking in the needle to the syringe and pulling off the cap like that. So now with my clean vial, I'm going to be inserting it into the Haldol medication and ensuring there's going to be no air holes in the medication, and I'm going to be retrieving 0.5 milliliters of the medication. So now I've got 0.5 milliliters of Haldol, and properly, without getting a needle stick injury, I'm going to insert it into the cap, and once it's inserted, I can pop it on to the lid. So now that my Haldol is properly into the syringe, I'll be using a medication label and attaching it to my syringe with the patient name, his room number, the drug, which is Haldol, the amount, which is 0.5 milliliters, and the date and start time and flow rate. Okay, so now that we are giving a subcutaneous injection to my patient, I'm going to be luer locking the needle from the syringe from the heparin medication and discarding this in the sharps container. So now that my heparin is ready, I will be luer locking it onto the appropriate needle, which is a 25 gauge needle. So now it is ready for the patient. So my next medication is Haldol IM, and so now we will be taking the luer lock off from the needle in the syringe and placing it onto our 21 gauge needle. So this will just luer lock onto the needle and be ready for injection. Now I'm ready to perform the subcutaneous injection onto my patient. So I will be performing hand hygiene and donning on the gloves for when I touch my patient. So before doing the injection, I'm going to use my patient identification. So I'll be asking Mr. Mancini his name and his ID badge for the hospital number to ensure that it correlates with my MAR. So now, Mr. Mancini, I'm going to be doing a subcutaneous injection just in your abdomen below the waist but above the hip in this area along the umbilicus. And so there's multiple injection sites, but Mr. Mancini has chosen this particular site. So Mr. Mancini, I'm going to be pinching your skin a little bit and inserting the needle to give you your heparin dose. Okay, so Mr. Mancini, I will be injecting your heparin subcutaneously now, and I will be cleaning the injection site. So once the injection site is cleansed, I will be removing the cap from the needle, and I will be inserting this at a 45-degree angle for proper insertion, and the heparin, 1 milliliter of heparin will go into my patient's abdomen. So Mr. Mancini, on the count of 3, will be injecting your heparin. Here we go, 1, 2, 3, and I'll be inserting the needle and pushing in the heparin into my patient. Once the heparin is in my patient, I will remove the needle from the patient and insert into the cap, just like this, and push the cap on. So now I'll be discarding this in the Sharps container. Okay, so now Mr. Mancini, we're gonna be giving your Halidol, which is an IM injection. So we're gonna be giving it in the upper arm, which will just be below the bone, a couple fingers below, and given on a 90-degree angle. So we have our 0.5 milliliters of Halidol here. And I'm going to take the bevel down and remove the cap. And now we're going to be cleaning the injection site on Mr. Mancini. And so Mr. Mancini, we're going to be giving your Halidol now, which will go in your upper arm. And yeah, so this at a 90-degree angle. We're going to go 3, 2, 1 and push it in all the way until you feel muscle, and then inserting the 0.5 milliliters of Halidol. So once it's all in, you'll be removing the needle and pushing the cap into the needle. And so this will get discarded in the Sharps container. All right, so now that both of Mr. Mancini's medications are done, which was heparin and Halidol IM injection and subcutaneous injection, I will be removing my gloves and performing hand hygiene. And I will record of this in his MAR and closely monitor the patient for any signs of infection or adverse reactions to the medication.